Hey everyone, and welcome back to the Arthritis Dietitian Channel. Today we're diving into a topic that might surprise you: the link between rheumatoid arthritis and your digestive health. If you or a loved one has rheumatoid arthritis, you probably focus a lot on joint pain. But what about your gut? Remember, rheumatoid arthritis is also a systemic disease. This video is part of the Talk Over RA campaign and was made possible by AbbVie Canada. However, all the content in this video are entirely my own. Here are 5 gastrointestinal conditions that can be associated with rheumatoid arthritis: temporal mandibular joint disorders, periodontal disease, dry mouth and swallowing difficulties, gastroesophageal reflux disease, and dysbiosis. So let's break it down. Number 1, temporal mandibular joint disorder. What a mouthful. The temporal mandibular joint is crucial for everyday actions like chewing, speaking, and even yawning. It is a complex joint involving bones, muscle, and cartilage. Now, if you have rheumatoid arthritis that primarily attacks the joints, it makes sense that TMJ could also be affected. In fact, studies show that a significant number of RA patients expressed pain around the TMJ. Imagine a Colombian burger piled with high layers. That was me trying to bite into a Colombian burger, and I couldn't even open 2 fingers. I realized that there was something wrong with my TMJ. So what should you be looking out for? You might experience pain in and around the ear, pain when chewing or yawning, and even clicking or popping sound in your jaw. Some people find their jaw gets stiff, especially in the morning, or that they have limited movement. They have difficulty opening their mouth wide. Why does this happen in RA? Just like in other joints, RA can cause inflammation in the TMJ. This inflammation can damage the cartilage and bone over time, leading to pain, dysfunction, and even changes in the joint structures, like that happen in my finger joints. So it's essentially arthritis attacking your jaw joint, the inflammation. If you're experiencing any of these symptoms, it's really important to talk to your rheumatologist and talk to a dentist who specializes in TMJ disorders. The diagnosis could involve a physical exam, imaging. Management requires the involvement of your rheumatologist. A dentist could be pain relief, physical therapy, splints or mouth guards for clenching, and rarely surgery. If you have RA and jaw pain and discomfort, don't just think it's a part of RA. It's important to recognize that early condition, and management can help prevent damage of the joint and significantly improve your quality of life. Number 2, periodontal disease. Periodontal disease is an inflammation and infection of your gums and bones that support your teeth, according to the Cleveland Clinic. A recent meta-analysis revealed a strong link between periodontal disease and chronic inflammatory conditions like rheumatoid arthritis. That oral bacteria causing gum disease. Studies show these same bacteria are found in high levels not just in your gums, but also in the blood and even the fluid around your joints in RA patients. This suggests they could be playing a role in the painful joint in RA. Treating periodontal disease could actually help in the control and management of rheumatoid arthritis. What does this mean to you? It means that you need a multidisciplinary approach, and it calls back to the TMJ disorders, that a dentist is also a very important part of your multidisciplinary team. It is crucial to be screened for periodontal disease, and the dentist could assess for this bacteria. If gum disease is diagnosed, non-surgical periodontal treatment is often recommended. And it's not just about healthier gums, but it's also about improving your rheumatoid arthritis toolkit. Have you ever considered seeing a dentist to help manage your rheumatoid arthritis? Number 3, dry mouth and swallowing difficulties. Do you know rheumatoid arthritis often goes hand in hand with another autoimmune disease called Sjogren's? Well, Sjogren's isn't just about dry eyes and dry mouth. It can cause debilitating joint pain, profound fatigue, and a whole host of digestive problems and other systemic manifestations. We're talking dry mouth from lack of quantity and quality of saliva. Dry mouth can be caused by many factors. Could be from medications, environmental factors, menopause, excessive consumption of caffeinated drinks, alcohol, smoking, and even stress. However, the dry mouth associated with Sjogren's feels like an unquenchable thirst, constant gritty sensation. You experience bad breath, a white coating on your tongue will wake you up in the middle of the night because you're just so thirsty. Swallowing difficulty in Sjogren's is not only associated with dry mouth, but it could also be associated with gastrointestinal dysmotility. So ask yourself these questions. Can I eat without sipping on water or any liquid? Can I eat a cracker without feeling that it's getting stuck in your teeth and your mouth? Do I wake up in the middle of the night looking for a glass of water? Do I feel like a bolus sensation in my throat every time I eat? When you are expressing or you're talking to your rheumatologist about dry mouth and difficulty swallowing, you need to explain these symptoms, how it impacts your quality of life. It's essential to include not only a dentist, but also a speech language pathologist. They can offer a thorough swallowing assessment and tailored recommendations. Additionally, a registered dietitian like myself can help you adjust your diet and food textures for improved ease and enjoyment of your meals. Number 4, esophageal reflux disorder. It's your gut hurting your joints. You know the struggles of RA, the stiffness, the pain, the fatigue. But what if I told you that uncomfortable tummy troubles like heartburn and nausea could actually be making your rheumatoid arthritis worse? It sounds strange, right? But recent research suggests that there is a significant link. We're talking about gastroesophageal symptoms and how they might secretly impact your rheumatoid arthritis. A study from Japan using the GERD questionnaire, which is a tool to identify gastroesophageal reflux disease, looked at over 500 RA patients and found some fascinating insights. They discovered that patients with moderate to high rheumatoid arthritis disease activity have significantly more gastroesophageal symptoms. Think about it. If you're struggling with heartburn and nausea, it's going to affect how you feel overall. Perhaps when your flare-up is coming up, do you feel that more gastrointestinal symptoms are happening? This study specifically highlighted that higher GERD scores correlated with more tender joints and worse patient-reported pain scores. It is a vicious cycle. Gut issues lead to lower treatment adherence, which can lead to more RA pain. Common symptoms of GERD include heartburn, regurgitation of acid, that you just feel like that acid sensation in your mouth, stomach pain, hoarseness or voice changes, sore throat, difficulty swallowing, dry cough, that sensation of having a lump in your throat, and frequent throat clearing. Talk to your doctor about your symptoms. If you're experiencing heartburn, nausea, or abdominal pain, don't just suffer in silence. You can also consult a registered dietitian. We can help you identify potential food triggers, manage your weight, and suggest lifestyle changes. But for today, just consider these tips to help you manage your symptoms. Cut down on your intake of caffeinated and carbonated beverages. Space out your meals by at least 3 to 4 hours. Avoid eating at least 3 hours before going to bed. And when you eat, stay in an upright position during and after each meal. Go for a 10-15 minute walk after each meal to get your gut moving. Let's go to number 5. Number 5, dysbiosis. There's a rapidly evolving area of research. The link between the gut microbiome, which is that community of bacteria, viruses, and fungi in your gut, and the development of scientists are actually finding that imbalance in the gut microbiome might play a significant role in triggering or worsening rheumatoid arthritis. Just picture this. 70 to 80% of the body's immune cells reside in your gastrointestinal tract, making gut health particularly important for individuals with inflammatory arthritis, like rheumatoid arthritis. It's like your gut is a silent conductor for your immune system. And when the orchestra is out of tune, it can impact the entire body. So this opens up exciting possibilities for future treatments focusing on our gut health. But remember, the gut microbiome is not only influenced by diet. It's influenced by your environment, the presence of infections, your sex, age, any comorbidities or other diseases that you may have, medications. There is so much we can't control. The one thing you can start doing is incorporating gut-friendly nutrients. The Mediterranean diet and high fiber diets, plant-based diets are associated with a greater abundance of health promoting bacteria. Those that actually produce short chain fatty acids like butyrate, and they help to protect the gut lining. When you're monitoring symptoms related to your RA, not just monitor joint pain, fatigue, or muscle pain and stiffness, also pay attention to any symptoms associated to your digestive health. So if you want to know more about those gut-friendly nutrients, please visit my website, arthritisdietitian.com. If you found this helpful, don't forget to give us a thumbs up and subscribe for more insights into managing rheumatoid arthritis. And remember to prioritize your entire body from bum to bum.